It's not like it won't happen. It will happen. You can do all the planning and management in the world. That's very much like the first question you asked. I can build the perfect home, but it will take me 10 years. So that's not practical. So you don't build the perfect home. You build a home that only takes you 2 years. And when you implement these systems, you don't want these projects to go on forever. So you have to minimize what you can do for testing, and you eventually have to put it in place. And then when you do that, sometimes you're faced with some of these challenges, and you've got to be able to respond quickly. So I would say the answer in my mind is always being prepared for the worst. And that requires planning and thought, so you can adapt quickly to resolve these issues and problems that are inevitable.
Hello, ladies and gentlemen, and welcome to our interview with Kevin Torf. Kevin is a project management innovator with over 40 years in the tech industry, and he is the founder of T2 Group, an IT consulting firm with more than 100 employees, and author of Getting the Job Done. And Kevin has transformed how large-scale tech initiatives are executed through better project management. But from bootstrapping a global software company to raising 50 million, Kevin's journey is a goldmine of insights on building, scaling, and exciting tech ventures. And his unique hybrid agile methodology, developed through years of hands-on experience, is now helping organizations save millions and deliver complex projects on time. So, Kevin, welcome to our Risk Management Show podcast today.
Oh, welcome. Thank you. And thanks for inviting me. And I'm looking forward to the opportunity of talking to you.
Absolutely. So it's my pleasure. So I believe that we will have a very thoughtful conversation on the topic of crisis management, turning challenges into opportunities, specifically with project management, and what is close to your area of expertise. But before that, could you tell us a short story about your career path, what brought you to where you are right now, and what you are up to these days?
I've always had a fascination for technology. As a child, I was fortunate enough to tinker around with software programming and electronics, mostly taught by my father, and took a career up in working in the technology space in South Africa. Came to the United States about 30 years ago and have continued that venture. Have been in various different disciplines and areas of the technology space, where today I am fortunate enough to manage the T2 Group, which has multiple companies within it, but all within the technology space. We focus predominantly on healthcare, and it's what keeps me up at night, and it what keeps the everything going, and I enjoy it. It's part of my life.
All right, fantastic. So our main topic is crisis management, but because I know you're based in the Los Angeles area, and you have been in the center of one of the major crises of the recent memory, maybe you can share some of your observations and what people can do to understand crisis. Can you share some examples of maybe some what you learned from the recent experience?
Well, I came here to California as I mentioned 32 years ago, and California has had its fair share of disasters, like many other states in the United States. Florida, as we know, has its flooding. New Orleans had its challenges. So, California is unfortunately plagued with fires and with earthquakes. So it's something that, you get used to, unfortunately, or, over time as these things occur. I've never seen anything as devastating as what we've experienced over the last week. And, like everybody else, I read what people's opinions are, and were people well prepared and well ready for an event like this. You can always find reasons and things that didn't happen the way they maybe should. With hindsight, it's very easy to be a quarterback. Uh, but at the end of the day, California does have a lot of regulations about how homes need to be built, how vegetation needs to be managed. Is it enough? Could always be more, but more also costs money. That means more regulation. It means the time-consuming efforts. I mean, to build a house in California already takes a long time. I did that about 10 years ago. I can only imagine if we now extended that even into 50% more time, that's going to have its ramifications as well. So it's hard to find that balance. As I'm learning, you can't, I think, change the act of weather. Yes, climate change has an impact, but that's not going to change overnight. We have to deal with where it is today. And really, the only thing I can, you know, think that what I would have maybe done, it's only my opinion, is just build better, protect your home. There's different materials you can use. There's different boundaries you can create around the house. There's different watering systems you can build.
Mhm.
And we can't rely on government to do all of these things for us all the time. We got to take some ownership and responsibility. But unfortunately, some of these homes were built 30, 40, 50 years ago, and we didn't understand some of these ramifications then. So could that have changed? I don't. I don't think so. I think it takes events like this for us to refocus and understand what do we do from preventing them again. So it's unfortunate, and the damage is just horrendous.
Okay, so let's then extrapolate to this to maybe technical word or work that you do. What strategies can an organization use to identify opportunities for growth or improvement during a crisis? For example, now
Well,
what you observe?
there's gaps. So, we mostly focus on healthcare, and we help build infrastructure and IT technology infrastructure for these hospitals to operate. So, the last crisis we saw was COVID, where the healthcare systems came under tremendous pressure to be able to operate. And just like the wildfires now, they realize some of their weaknesses. Were they able to triage as fast and as quick as they wanted? Were they able to get the resources that they needed to be able to fulfill the patient's needs? Did they have the systems in place to deal with the unique challenges that COVID presented? And a lot of healthcare systems didn't. A lot of healthcare systems struggled with people having to work from home, and how do people work from home and still do things that they were normally doing every day, where they were actually on site in the healthcare facilities. So those are opportunities, and they're opportunities to help really prepare the healthcare system for the next pandemic. And we've been very fortunate enough to be able to be involved in some projects that we've been able to help facilitate. And hopefully they'll now be more prepared than they were in the past. So, yeah, I consider that a way that we've been able to capitalize on something that was very unfortunate as well.
Mhm. So, how can an organization foster a culture of agility and innovation to pivot quickly during the crisis? Or because you are based on your my most experience in the IT industry, and this is a major. The change is all it's every all time is changes. So it's you now with AI and a lot of systems in healthcare may be a little bit outdated. What is your opinion on this?
Uh, I think the way that we've managed this and dealt with this, and we've been doing this for most of the T2 group's existence, is the methodology and approach we use to how to execute and uh, complete projects. We do it in a very iterative style. It's predicated on some agile methodologies. We've adapted our own. It's a little bit of a hybrid approach because there are different types of ways to execute on projects. There's the typical waterfall approach, and with technology companies evolving over the last decade, agile's become another way of doing this. And we've always operated like this for the last, 15 years of our existence. The benefit of doing this is it allows you to make changes very iteratively and then reflect on what you're doing. This allows you to be, I believe, very effective. So in a crisis where you don't have time to do significant planning and spend 3 months contemplating what you're going to be doing, it's a crisis. So you maybe have time to do a few hours of planning, if anything, but you need to plan. You can't not plan. But then you want to execute and you want to actually go do what you planned and then go back and replan and do it again and again and do it in a very iterative style and then consistently reflect. Is it working? Isn't it working? And adapt as you learn about both the ways in which you need to to execute, how to be more effective, and then also the world changes as you go in and you're doing these things. So you need to consistently realign what your goals and objectives are as you execute and deliver on what your initiative is.
Mhm. So you said you wrote a book. Can you show us your book? We can maybe put a link. Getting the
Sure.
job done. Yeah. So what is the main idea of this book? Can you share with us?
Yes, what I've learned through my experiences is many times we talk about what we want to do, we contemplate what we want to do, but we very seldom sometimes get it done. Uh, and I've always grown up and I was taught from my father, that, stop telling people what you're going to do and do it.
Uh,
Complete any initiatives. So in very large scale projects, there's a lot that happens. There's a lot, these take long periods of time. The environment changes, the scope of work changes, and that is typical. It's going to happen, and it's how to adapt to this. It all needs to be done with, I think, a formalized methodology. The book was predicated on the word projects. We use that as an acronym. P for planning, R for reflection, and through each one of the letters of projects, we have project management philosophy and guidelines in order to be able to apply uh, with the intent of being successful, getting the job done. You have to, build a new data center, implement a new EMR application, electronic medical record system, or whatever your intent is. But how to get it done on budget, how to get it done on time, on schedule, and how to keep your scope intact. So you have these three constraints whenever you execute on a large project, and it's you're finding ways in which you can manage that and complete what's required.
all right. So, Kevin, I would like to ask you a personal point of view. What are some major misconceptions around the uh, crisis management that you kind of strongly disagree with?
I think people sometimes panic a little too much, that when things go wrong, I think you need to sometimes go slower to go faster. I think and I've only learned this over the years of getting more experienced and maturing myself. But, I think it's very typical when we're in these predicaments, we want to just react. And, being agile doesn't mean just react. It does still require planning, and you need to slow yourself down, and be able to plan enough to be able to put things in place where you can measure whether they're working or not, because we have to always be able to reflect and say, is this where we hope to be? Are we doing this in the right manner? Are we getting the results that we wanted? And that's an important step in the process to evolve. So yeah, what I see happen very often is people sometimes start rushing around. It's like when you go into a restaurant and you see waiters running all over the place. It creates an atmosphere of disorganization. People start losing trust in the system and the process. And if they just walked to a table, the time difference would be so insignificant, they'd probably be even more effective, and they'll show a level of a control over a situation. So yeah, I summarize by saying sometimes we react too quickly, and slowing down sometimes can allow us to even do things quicker.
All right, fantastic. So let's drill a little bit deeper. For example, if we take life of our average audience, our risk and compliance manager, if there is one thing that they should start to prioritize right now that they are not doing, what would that be?
Yes, whenever again, I'm going to relate it to the work I do when we execute on a project, again, being in healthcare, uh, everything we do could be disruptive. If we do something incorrect or we don't do something in the right manner, this could have a significant impact on the patient population of that healthcare system. Having no tools available to manage these patients because of maybe systems not operating and failing. And this would be the same whether it's a financial institution, being a bank, or being in any industry, a large retail store. If they don't have the technology to be able to service their clients, that's disruptive. Their organization will not operate for, maybe a few minutes, hours, even days sometimes. So it's trying to anticipate what those implications could be. And whenever you doing change or you implementing new systems or putting in new technology, you open up that potential ramification of affecting the current process and workflow. And I think, we don't anticipate enough what that might be, and be prepared, because it does happen and it's going to happen. It's not like it won't happen. It will happen. You can do all the planning and management in the world. That's very much like the first question you asked. I can build the perfect home, but it will take me 10 years. So that's not practical. So you don't build the perfect home. You build a home that only takes you 2 years. And when you implement these systems, you don't want these projects to go on forever. So you have to minimize what you can do for testing, and you eventually have to put it in place. And then when you do that, sometimes you're faced with some of these challenges, and you've got to be able to respond quickly. So I would say the answer in my mind is always being prepared for the worst. And that requires planning and thought, so you can adapt quickly to resolve these issues and problems that are inevitable.
All right. Awesome. So that's why all my questions. Perhaps if I forgot to ask you something that is important to our audience, Kevin, please go ahead.
Uh, it's really just about, how do when you deal with, and again in the framework of implementing projects, there's what we've been discussing, the planning and anticipating problems. You do need organization, as well, to structure things and have some governance around how decisions can be made and should be made. We spoke about reflection. I think the area that gets missed a lot is, in projects, the letter T for teamwork. It's about collaborating and getting people to share their ideas and thoughts, because I think when that occurs, you get the best out of you get the best outcomes. And it's being able to really coordinate and lead those teams into being creative and trying to understand all the probabilities and all the potential risks. So I think that's a very important component of being prepared, because today, we're only as really as good as the decisions we each make. So if we can join together and as a group make better decisions, that will help us with our risk management and being able to be more successful.
All right. Thank you again, Kevin. And I wish you a great success and to your T2 group. And we will be in touch when everything will be released. So I please send me a link to your book, and we will put it in our show notes.
No, I appreciate it, Boris. Thanks for taking the time, and I enjoyed the conversation. And I read through some of your material as well. I think you had the two books, the to-do lists of risk management. I looked at
Oh,
some of the items that you articulated, and no, it's a very interesting subject. And in life, we always find crisis. There's crises all over the world right now, and how we all live with this, not just in business, but in personal life as well. So I like what you're doing and some of the guidelines you've provided.
thank you very much. Thank you again.